Hello everyone, I'm Dr. Gauri. I'm working as a clinical research associate at StemRx, and today we are going to talk about ankylosing spondylitis. Ankylosing spondylitis is a inflammatory disease. It affects specifically on joints and spinal cord, sacroiliac joints, and even hip joints. It is an inflammatory condition of a joints, causing it restriction and stiffness in the joints. Basically, it is seen, the initiation of this disease is seen in early 20s till late 40s. It is an adolescent disease, and it has been seen specifically in the people with HLA-B27 positive gene. HLA-B27 positive gene is mostly present in lots of people, but everyone doesn't suffer with ankylosing spondylitis. There are some triggering factors which make them people to develop such type of symptoms in them. Probably at the ratio of men and women, if we see 3:1 is the ratio. Males are more prone to suffer with ankylosing spondylitis. Okay, so let's see how the disease progresses. Initially, if we see, person started developing early morning stiffness. The morning phase is very hard for them. Pain factor is there, tightness is there, stiffness is there in the joint. Slow movement, early morning movement, it's very slow. Gradually, as the day progresses, the movement start getting better. But as disease progresses, the fixation of the joint start getting more and more firm. The rigidity start getting more affected. Spinal cord is more prone to have a fixation. With that, hip joints and knee joints, even sometimes it is seen in the ankle joint also. There is a very common term which is seen in ankylosing spondylitis. It's called as a bamboo spine, which makes a neck stiff. Person is not able to move the neck. His spinal cord gets stiff. His lumbar spine gets stiff. He's not able to bend forward. He's not able to bend sideways, backways, which make all his movement very much restricted and painful and slow. Gradually, as the disease progressed, he started getting stoop. His shoulder gets stoop. He started getting bent forward. His lifestyle get affected a lot. The treatment which is available for in this phases are, in initial phases, painkillers are very commonly used. When there is excessive pain, doctor advised to go with the steroid injections. Immunosuppressants are very common. Then recently there had come the biological injection. Biological injection has shown good response in initial phase of the time. But the patients who had already developed the fixation in the joints do not show any response with the biological injections. With that, in the end phase, there comes the replacements like joint replacement. With the hip and knee joints, you can go with the replacement, but there is very much risk factor in fixations of the vertebrals. We cannot do any replacement in the vertebral columns because that is very risky and nerve endings are being involved in that. Okay, so, and the last part is HLA-B27. I would like to discuss on HLA-B27. Why it is seen that lots of patients who are HLA-B positive do not suffer with ankylosing spondylitis, but some patients suffer with this. It means with our lifestyle, there are some of the triggering factors which initiate these disease, formation of this disease in ourselves. So it has been studies, researchers has been seen that digestive system, means intestinal health, plays a very major role in formation of autoimmune diseases. Like not only with ankylosing spondylitis, different type of arthritis, skin issues are somewhere related with the digestive systems. Okay, so we have to focus on digestive system. Why it is being seen nowadays that digestive system is being affected? Because of our lifestyle, how we are going with that. Even there are some microbiomes which are responsible to trigger out, to initiate such type of autoimmune diseases. Microbiomes like Klebsiella pneumoniae. The role of Klebsiella pneumoniae is also seen in a very major part in developing such autoimmune diseases like Crohn's disease, ankylosing spondylitis, and the factor which are responsible for developing Klebsiellas in the intestines are like junk food, undigested food, strong fatty foods are responsible for that. So what we had initiated with that, whenever person is suffering with diagnosed with ankylosing spondylitis, first of all, we should focus on his intestinal health to improve the gut flora. By improving the gut flora, the inflammatory marker, the cytokines levels of the body can be bring down. Okay, for this we go with the FMT. FMT is the Fecal Microbiota Transplant. If anyone have any questions, they can put in a chat box. We can have a discussion on that at the end of the webinar. Okay. So FMT is a fecal microbiota transplant. It means the good bacteria which are responsible for maintaining a pH level of the intestine, which are responsible for maintaining the digestion of the food, which are responsible for maintaining the to reduce the acidic level of the intestine, and also responsible for improving the absorption of nutrients of the intestine. By improving these good bacteria colonies in the intestine, we can remarkably reduce the inflammatory factors in the body. This will help to reduce even the cytokines levels. Formation of antibodies will also reduce. So how we can do this? FMT can be done by different ways. We have to isolate a good bacteria colony, which are the Clostridiums, and it has to be transplanted into the intestine. It can be done by many different ways. We go with the very most minimal invasive ways. It can be done by endoscopy. It can be done by colonoscopy. Even it can be done by normal enema also. Any ways which is comfortable can be selected. We can go with that. Lots of patients we have seen after going with the FMT, their early morning stiffness, pain intensity has reduced very less, has come to a very lower side. Why? Because as we see, digestive system is on an active phase on an early morning time, and even in ankylosing spondylitis, early morning time is a painful part. So whenever we go with the FMT, it helps to improve the digestive system, reduces the constipation level, reduces the flatulence, reduces the gaseous distension, reduces the hyperactivity, which indirectly work up on the reduction in the pain factor in the joints. Okay, so FMT, that's why we lots of times says that we go with the probiotic, we go with lots of curd, dahi and all, which work as a carrier of the good bacteria for our body. But in the cases with ankylosing spondylitis, where the need is on a higher side because cytokines levels are on a very higher side, antibodies of this condition are on a very higher side. With that, we also have to take care of some things which some food or some medications which are responsible for killing these good bacteria. Like we had seen lots of times, self-medication, excessive intake of antibiotics should be avoided because it completely destroys our intestinal floras, disturb our intestinal environment. That's why it's been told that once in a day, a person should have a curd to improve his digestive system. Now, the next part which comes up is the nutrients. We'll talk about super nutrients. COVID phases actually have taught us lots of things why nutrients are important in our life. Just like vitamin C, we came to know after a long phase, vitamin C is very commonly used, but we came to know that vitamin C is responsible for good immune system. Same way, there are different type of vitamins, minerals, and antioxidants which plays a major role in maintaining our body health. Okay, in ankylosing spondylitis cases, magnesium therapy plays a good role in reducing the inflammations and pain factors. Magnesium is actually mineral. Okay, it is being found in a water. It is food products like spinach, almond is rich of magnesium, and beans are rich of magnesium. But whatever food we take, almond, spinach and all, from that nearly 30% is only been absorbed into the intestines. Rest all is wasted. And if we see, nearly 60% of population is deficient of magnesium. Why this is happening? Because water is the largest source of magnesium carrying part. But nowadays we get completely water which has been purified to us, which in from that all the minerals have been removed. So we do not get magnesium from the water. And any of the other food product from which we get magnesium are on a are very less. We do not take in that much sufficient part, because nearly the magnesium which is we need for a whole day, it contains nearly 2 bowls of almond, and we are not going to eat 2 bowls of almond in a day. So we get deficient with that. Magnesium plays a major role in different parts of our body. First of all, it works on our immune boosting, nextly digestive system, even it works on our memory, it works even on our sleep also. There are different combinations of magnesium available in the market. Okay, so every magnesium have their own role. If you go with a laxative, the medicines which are being given for to improving the digestion, to reducing the constipation, all have magnesiums. With that, there is a different specific combinations which are being used to improve memory functions also, to calm down the kids. Even it has been given to small kids when there is hyperactivity, cognitive behavior issues. For them also magnesium is being used. So how it going to help us in ankylosing spondylitis? Magnesium, when it is being taken orally, it blocks the synapses. Synapses are the joint between two nerves from where the message is being passed. The nerves are joint from where the message is being passed. So when it blocks these synapses, the pain response slows down. So the patient will do not feel that much of pain. Rather than taking any strong painkillers or immunosuppressant, if you go with the magnesium therapy for a regular longer time, it do not have any side effect on the body. It do not affect on any other organs of the body, and also reduces the pain factor also. Okay. Magnesium have its also own role in bone development. Nextly, it also have its role on blood pressure regulation and glucose control also. Okay. And excess of magnesium or toxicity of magnesium is not possible, because if you go with excess of magnesium also, it will get flushed out through the intestine, as it works on the intestinal health. But in some cases, magnesium should be avoided, that are kidney patients, patients with the Crohn's disease, and patients with the intestinal obstruction. These patients should not take magnesium without consulting their doctors. Rest all peoples can take magnesium, but regards that which magnesium combination should be taken should be properly checked up, and then you can take it. Okay. So magnesium therapy, how it works. With that, some of the antioxidants like coenzymes, glutathione helps to reduce oxidative stress at the inflammatory factors areas. So it makes your joints little lighter to feel up. Okay. Then there comes regenerative medicine. Anyone knows about regenerative medicine, how it goes up? Because this is the fastest growing medicine field in the recent researches. Regenerative medicine is actually help for regeneration, repair, redevelopment of damaged part of the body by using body's own repair system. We use body's own growth factor to heal the damaged part of the body. Like everyone have their own repair system. Everyone have their own immune system. Okay. If we get any injury, it is gonna to heal by itself. But when, so this power of ourself of using regenerative medicine we can help to improve the quality of the joints. We can help to improve the movements of the joints which are being affected. So for this, what we do, we take out the growth factors from a body and inject it on the areas of the joints which are being affected. What does it helps to improve the space of the joints, reduces the inflammatory factors of that area, reheal and regenerate the cartilages and the tissues which are being damaged over there. So it helps to improve the mobility in the spine. In the we had seen that the patient which are having fixed joint has shown good responses with going with the regenerative medicine with the combination of VIPP. VIPP is a very intense pulse pressure. It is a sound wave shock therapy. You must have known about ESWT, how the in kidney patients to break the kidney stone, ESWT is being used. Okay, and without any invasive procedure, these stones are being removed out. In the same way, but here the shocks are being monitored. The intensity of shock are being monitored on a lower scale as per the depth of the bone. So when we go with the excuse me. Okay. So when we go with the VIPP, VIPP gives a sound wave shocks on the specific areas of the joint which are being fixed. When these shocks are being given over there, it causes a fine microtraumas, and these fine microtraumas initiate the growth factor of that area. When with the combination of regenerative medicine and this VIPP is given, it enhances the development of that joint. Repetition of this has shown the movement in the increase in the mobility of the spine. It has also seen that gradually the restriction is reduced, the mobility gradually started getting better, the stoopness of the shoulder, even the neck movement, lumbar spine movement are being increased after going with these sessions. You have to go with the repeated sessions of this, but definitely it has shown good response in improving the movements of this. It improves the joint space, reduces the fixation. Even VIPP helps to break the calcifications also. Fine microcalcification without forming any fractures. It improves, it helps to increase the mobilities. Okay. And then there comes this the role of shockwave therapies, how it's going to go with the combination of regenerative medicines. And so the last part is dietary. How diet is going to work upon this? As we know that diet plays a major role. As initially only I have told, intestinal health is very important. In India, we had seen our food contain lots of carbohydrates and sugar also, even lactose. Milk is being as a it's called as a superfood in our diet. But nowadays, if we see the qualities of all those things are not at that mark which used to be before. Milk is complete full of hormonal injections, and which are responsible for increasing of autoimmune diseases in even in the kids. Lactose intolerance sensitivities is being commonly found nowadays in lots of people. Why this is coming up? Because the lactose which we are getting is not of good phase. We have to focus on these areas that our food should be less of lactose, because whenever we take lactose, it affects on digestive system. Lactose milk is for a cow or for a buffalo because they got 5 stomachs to digest lactose. We got only 1 stomach and it doesn't have any capacity to digest it. What we get calcium from that is a very minimal. For that, we affect very much to our digestive system, to our stomach and the intestines also. Next, there comes the gluten. Nowadays, it's very much seen that gluten sensitivity, if you eat wheat bread or chapati, people started getting joint pain, hyperacidity, irritable bowels. So these gluten have a tendency to develop immune system, autoimmune conditions, to increase inflammatory factors in the intestines. Even in the kids with excessive mental issues like hyperactivity and autistic kids, it has been told them to eliminate gluten from the diet. Gluten is contained in a wheat and wheat products, and even in the barley. Barley is not eaten in India, but in some countries of the world, barley is being eaten actively. So this gluten increases the inflammatory factor in the intestine, which also leads to cause the autoimmune conditions. And last will be the sugar. White sugar is like a poison. It increases hyperactivity. It has no work and no nutrients we get from that. We already get lots of glucose from the food which we are eating. Okay. Every food, like we eat fruits, we eat nuts, everything have glucose. We don't need excess glucose. Yeah, if you want to shift white sugar with anything else, you can shift it to the jaggery, you can shift it to the natural honey, or take any natural sweeteners, but don't go with the white sugar. Good nutrients for our body are vitamin D. Vitamin D is very important for our body. Nowadays, as we stay constantly in AC rooms, very less exposed to the sun, that is also very less absorption also, leads to deficiency of vitamin D. Vitamin D plays major role in bone health, definitely bone health. Even it works on inflammatory markers of the body. If you have severe pain, if you take vitamin D tablet, you will find it without taking any painkiller, your pain is coming down. Okay. It is also work on immune system regulation. Even good level of vitamin D helps to improve the memory functions also. There is omega oil. Omega oil works on immune system. Omega oil you can take anyone, like you can take fish liver oils also, or if you are a vegetarian, you can go with the natural omega oil contained like flaxseed, sesame seed, or you can go with the capsules, okay, which are rich with omega oil. Omega also helps to reduce the inflammatory response of the cytokines. Then B complex, it works on production of white cells, white blood cells. White blood cells are our what we can call, it's our immune system. It works as a fighter for our external infections. So B complex has to be there. Then selenium, zinc, probiotics, as initially I told, how FMT works on it. Like that, probiotics are the food for the good bacteria. When we take that, good bacteria count started getting better in our body. Now, the most important part is physiotherapy and exercises. In ankylosing spondylitis patients, exercises are most important. Whatever you do, all the things, VIPP, regenerative medicine, if you go with FMT, everything you go, if you're not going to do exercise, it is again going to go back to what you were. Whatever movement possible you can do, you have to keep on doing that. If you don't do it, you will again come back to those last phases where you were with the restrictions. Daily exercises is very important in ankylosing spondylitis. It has to be done on daily basis. With the help of the physiotherapist guidance, you can do it, and then regularly you can do it by yourself. Continue exercises helps to gradual increase in a movement of the joints. It reduces the fixation. It doesn't let your joint to get fixed at any phase. If you keep a joint unmoved, it is going to get calcified, and again you will end up, if you are there, your movements have been started, and if you stop doing exercises, it will again go back to the fixed position. So you have to go daily basis on the exercises. It helps to reduce pain, increases the movement, reduces the paraspinal muscle pains also. Then there is one more therapy. It's called as a rhyme therapy. Rhyme means rhythm. Okay. This Rhyme therapy specifically works on lymphatic system drainage. Lymphatic system, if you know about lymphatic system, it is a lymphatic chain which goes parallel to the spinal cord, and it goes completely toward all over the body, the hands, legs, everywhere. Lymphatic system plays major role in regulating the body fluids, blood volumes, carries the hormones and other minerals to all over the body. It is also called as a lymphatic drainage, because drainage, why? Drainage is the waste part. Lymphatic systems absorbs the metabolic secretions of the cells, which causes inflammation and removes it from our body. So when we go with the Rhyme therapy on a body where there is a fixation happens, it activates that part of that area's lymphatic drainage and reduces the inflammations in that body, increases the circulation of that body, of that area, and which helps to improve the cell count, growth factor in that area, which gradually start developing the natural healthy cells in that area. Okay. Then the last part is the most important, is the self-care. Why it is important of self-care? Every ankylosing spondylitis patient go with the lots and lots of pain. Every morning is challenging for them. Every movement is challenging for them. Their speed is lesser than every other person. They are slow in the movement, which causes them more frustration and constant taking of medication. And the age group which are involved in this disease are of early 20s to late 40s, which is the most active lifestyle age of the body, of the person. So he has to take care of every part, like his diet, his exercises, his mind setups. Okay. And so these are the pictures of HBOT, and this is the pictures of VIPP. HBOT is a hyperbaric oxygen therapy. In this, we expose a patient. The patient has to sleep in this, and we expose the patient to high pressure of pure oxygen. It's a higher pressure than environment, and pure oxygen is exposed to that, which increases the oxygen concentration in the cells. When the cells oxygen concentration get increased, their proliferation improves. So when we had injected regenerative medicine in the joints which have been affected, the cell growth get enhanced. The response get more faster and last for a longer time. So how this all program will work up for ankylosing spondylitis patient? First of all, his autoimmune status will get down. His immune system will get regularized from inside. If you go with the detoxification by doing FMT, giving nutritional therapies, and then targeted therapies. Targeted therapies means where there is targeted joints, we go with the VIPP, regenerative medicines, then Rhyme therapy, shockwave therapies. These targeted areas been focused up, and with that, nutrition, diet, and exercises. So when we go with all these parts, patient comes out of his fixations, comes out of his affected areas, comes out of his tightness and stiffness, and can go with the better conditions in his life. Yeah, someone has asked about cupping therapy. Cupping therapy can somewhere reduce the pain of the areas, but it definitely it can reduce pain of the muscle spasm areas, but not of the joints. The joints which are being fixed, it cannot be mobilized with the help of cupping therapy. Magnesium, the best magnesium which is good for ankylosing spondylitis condition can be magnesium citrate. Magnesium oxalate is also good, but you have to check out with the combinations. Okay, don't go with any laxative of the magnesium. Is not going to help anyways with the pain. See, it is not necessary that it should start with SI joint only. It starts with the pain, early morning pain. Early morning, it starts with the complete stiffness, pain in the muscles, pain in the joint, difficulty to bend forward, slow movements are there. Patient do not feel fresh in the morning. But yes, SI joint is very commonly seen to be painful in ankylosing spondylitis initiation. But it is not compulsory that if you have SI joint pain, then you are definitely suffering with AS. It's not like that. SI joint pain can be there in lots of different conditions. Okay. And it is also not important that if you are HLA-B27 positive, then you are having AS. It's also not like that. AS have its own pattern of treatment, pattern picture of a disease. So don't jump on any conclusion that if you have SI joint pain, it means that you are suffering with AS. Not at all. It has to be properly diagnosed and then be decided. Chiropractics is helpful in AS, but it helps for a temporary relief. Okay. It will help if there is a fixation in the joint. You feel that the neck is stiff, your muscle, trapezius muscle is tight, your spine is tight, then you can do it. But again, you are going to go in that phase after a specific duration of the time. Chiropractic relieves pain for a specific duration. It is helpful in when there is severe pain or you find it very tight. It can be helpful, but you have to be careful because here there is no muscle spasm. Here there is a joint fixation. And it is being seen due to the recurrent inflammations in the body, bones of AS patients get osteopenic and gradually it goes to osteoporotic also. So you have to be careful whenever if you are going to put any pressure on your bones, it should not go any adverse way. Neck stiffness can be of lots of different conditions, like it can be due to trapezius spasms also, it can be due to neck muscle, cervical muscle spasm also, or it can be due to the cervical spondylosis also. You have to go with the x-rays. You have to check that if there is any calcification in the neck or not. And according to that, you have to decide if neck stiffness is there. And in ankylosing spondylitis, how the disease progresses, it goes from lower to upper. Neck stiffness comes on a later phase. So for cervical, first of all, get diagnosed with the cervical issues. You have to check out if there is any osteophyte formation, because lots of time if there are small osteophyte, which is common in cervical spondylosis, can also causes restriction in neck movements, or tightness in the muscles can causes restriction in neck movements. Please get diagnosed with that first. Lots of time it is seen that people who are not HLA-B positive, 27 positive, still suffered with AS, and that's why it's an autoimmune disease. It's not compulsory that every HLA-B positive patient will suffer with AS, and it's also not compulsory that if person is negative will not suffer with AS. That's why it is researches is being done. It shows that there are some triggering factor which initiate such type of diseases, and this trigger factor is related moreover towards the digestive system, and also lifestyle, stress. Stress is the major part of the body. Major part also plays major part in disturbance of digestion, food patterns, then lifestyle and our habits. In ankylosing spondylitis, to avoid further complications for osteoporosis in AS, first of all, you have to start treatment in the initial phase of the time so that the disease should not progress further. So that the inflammatory factor should be on the lower side. Person should focus more towards the diet, should go with the natural diet with lots of green vegetable, lots of fruits. Colorful things are very helpful for the body. Nextly, he has to go with, as I told you, with the magnesium therapy. He can go with supplements. He can go with. There are some other injections which are helpful to improve the density of the bones also. That can be taken by AS patients. It will be advised to you by a rheumatologist or by orthopedic doctor also. We had seen that lots of ankylosing spondylitis patient suffer with easy fractures as they already have restrictions. Their movements are slow. If they slip off and had a fall, they get shaft fractures also very easily. So we have to keep the inflammations and cytokines level on a lower side so that the porotic condition should not come. If you need more information, you can go on the site and get it. We had lots of patients are also there who had shown good responses. Their stoop shoulders has been straightened up. Their bent spine has been straightened up. Their lifestyle get better. You can check it on the sites. Due to the privacy issues, I have not shared those patients on the this public forum. See, every pathy have their own specific role in treating the disease, in treating the patients. It's on our choice, and as per the responses, how it shows you the response, you can go with that. But if you're taking homeopathy, still if you follow the things which I told about the digestions and nutritions, it is going to help you with that. It's not because no pathy over here with the treatment which I explained you contradict to each other. How to protect from AS? Okay. First of all, we should maintain a good lifestyle. Exercising every day, nearly for half an hour. 5 days in a week is very good. Focus on balanced diet. If you like any junk food or food with the preservatives, packed food, please keep it on an occasional basis. Don't go with a regular form. Try to have home cooked food. Go with lots of fibrous food. We think that green vegetables have lots of fibers, but it's not like that. More fibers are on millets. Millets get excess fibers, which works, and it is also easy for digestion. Shift yourself from wheat to the millet. Shift yourself from sugar to the honey or a jaggery or any natural sweeteners. Nextly, take good sleep. Fourth part, most important, is your work schedule. You have to be okay with what the work you are taking. Don't take excess stress for that, and don't think that you will suffer with AS. You don't have to protect yourself with AS. You just have to live healthy life. Exercise, range of motion exercises depends different with every person to person. What you are suffering with, according to that, you have to go with the exercises. But every joint mobility should be done on every daily basis. You should start from the neck till the toe. Every joint movement you have to do. What type of movement that joint does, you should try to do it with a specific count. That much also, if you do on a daily basis, will help to maintain your joint health. Homeopathy can help to cure AS. Yeah, it can help to cure AS, but with that, you have to follow all these life schedules also. Regenerative medicine plays a major role in reversing the disease with the help of VIPP, rhyme therapy, hyperbaric oxygen therapies, and HBOT had shown good progression in the condition of the patients. Other therapies, other pathies will reduce the inflammatory factor in the body, but the fixation which are being occurred, the pathological condition which are already being formed in the body, to reverse that, you can go with this session, with this treatment. You can go with egg whites. Avoid red meat, please, because red meat is very harmful for digestive system, and it contains some of the parasites which not even get killed, even when they are cooked on a high flame and high temperature also they are present, and then they sustain in our body again. Okay, it was nice to talk to you, everyone. If you have more questions, please put it on our site, even on the YouTube channel of StemRx. We are there to help you out. Thank you.